Behind the sealed doors of an intensive care room, medical staff treat a patient seriously ill with COVID-19. Baby monitors used to communicate with those outside to avoid the need to move in and out of the area too often. The signs on the doors here, the ventilators, the sick lying on their stomachs to aid breathing, tell the story of a unit dealing with the second massive wave of the virus in Belgium. And this hospital in Liège is at the heart of the worst-hit region, Wallonia. All of the beds currently set aside for COVID patients here are now full, and doctors like Laurent Jadot fear having to make agonizing choices.
What I fear is when the hospital is fully full of patients hospitalized, and if we have to choose which patient is able to survive and which patient is not. That's actually in my bed. When I'm thinking about that, that's what I don't want to leave.
While we were here, a patient died with COVID. There was an agonizing scene as family members not allowed in the room peered through the window. The daily number of cases in Wallonia inevitably means more ICU beds will be needed in the coming weeks, but staffing will be a major issue. The doctor we spoke to said many people are now calling this part of Belgium the new Lombardy, referring to the Italian region hit so hard by COVID in the first wave. And there are real concerns here now about whether the health system will be able to cope. The Red Cross is now supporting the effort in Wallonia, manning COVID-only ambulances, the staff on board disinfecting the vehicles on return. Paramedics say they're seeing many more young people in the second wave and fear what the coming weeks will bring.
Je pense que l'inquiétude qui règne chez tout le monde, c'est justement ça, c'est cet afflux de personnes qui d'ici, maintenant ça fait plus ou moins une semaine, on a vu doubler, voire tripler. C'est la peur que cet afflux continue et qu'on aille dans des démesures totales. C'est cette inquiétude-là qui reste en tout cas en première partie dans nos têtes.
In Wallonia, like the rest of Belgium, bars and restaurants have been ordered to close for a month. A nighttime curfew has been implemented and people told to limit social contact outside the home to one person. But there's a warning from the government that if cases continue to rise, more stringent measures will be needed.
Well, what we want to do is avoid a lockdown. It's not really something we planned for, but if necessary, if you have no other option, yeah, that's the only thing you can do. When you see that your hospital capacity is becoming overwhelmed, then you need to take action. And in the last instance, that will be a lockdown.
Many doctors argue that drastic step is necessary, with the number of COVID cases spiralling out of control. They have genuine fears about their ability to manage the situation heading into winter. Michelle Clifford, Sky News, Liège, Belgium.